Good afternoon and welcome to our July 22nd, 2020 press conference here in Seminole County. Today we'll be giving you quite a few updates. Today we have Michael Lawrence from the school board with us. It's going to give you some information related to schools opening. We also have Alan Harris from our emergency management division that's going to also give you an update, as well as Donna Walsh from the Florida Department of Health is with us also today. First, I want to take a moment and thank all of our residents for their continued patience and their diligence in trying to adhere to the best guidelines that have been put out by CDC in distancing of keeping your 6 feet, keeping your hands washed, wearing your mask when you can't keep that distance apart of that minimum of 6 feet. I also want to take a moment and thank all those people on the front line, our law enforcement officers, our EMS and firefighters who are really truly on the front line each and every day responding to many calls when it comes to illness and sickness around the county. I also want to thank the staff at Seminole County. The staff has been doing yeoman's work here lately, trying to get things ready for our upcoming budget. And as you can imagine, our budget has been impacted significantly with the downturn in the economy. This is why it is so important that we try to keep the health first and foremost with our businesses and as well with our community so that businesses can remain open. Whether you're a patron, whether you're an employee, I think it's paramount. Whether you agree with a mask or don't agree with a mask, the reality is the economic impacts are going to be greater if we don't follow the CDC guidelines and do what's right. And I thank all those that have continued to do that. I also want to thank the news media for being here today to help us get the message out and continue to give the updates to our community as we give them and as they get them on a daily basis. Today I'm going to talk a little bit about the economy and what we're getting ready to do here in Seminole County. We've talked about the last couple of press conferences of what grant monies we're going to be putting out. I'm going to give you a little more detail on that today. As you are aware, Seminole County Board of Commissioners approved a comprehensive release package to spend $82 million in federal CARES Act funding at a county work session last Tuesday, July 14th. I want to thank my fellow commissioners as well as the 7 cities who have participated in these conversations and agreeing on how this money is going to be distributed. The program is now going to be referred to as Seminole CARES, so keep that in mind, Seminole CARES. Approximately $7 million in CARES funds will be invested in grants for our residents. $10 million will be allocated for small business grants. The Seminole CARES small business grants will break down as follows. We'll begin accepting applications for the second round of small business grants, the Seminole CARES grant, sometime in mid-August. Business grant awards will be between $5,000 and $15,000. These will be a one-time grant to address losses related to COVID-19. 5,000 grants will be awarded to home-based businesses that have one W-2 employee that is not the owner, as well as mobile businesses. And that was a big discussion and a big question when we had our first CBDG funding of the $1.2 million we had just about a month ago. We also are going to give $10,000 worth of grant money for businesses between 2 and 25 employees. So it's going to be a step type approach. $15,000 of grant money will be awarded to businesses with 26 to 50 employees. Communications regarding grant criteria and required supporting documents will begin later this week. As I mentioned, you need to continue to watch our website at prepareseminole.org. We'll continue to give updates there. Also, you can sign up for alerts so that when things start to tick or click or anything changes or anything is updated in regards to the business grant program, you'll be alerted to that. Interested applicants should visit the sites to learn more about the grant criteria, the required supporting documents, and when the grant application process will begin. We're encouraging businesses to sign up for email updates regarding the Seminole CARES Small Business Grant Program by visiting seminolecountyflorida.gov or prepareseminole.org. Click on Businesses near the top of the page and then click on Sign Up for Notifications. That'll get you into the queue so you can sign up for those advisories when things come available. Eligible businesses must be located in Seminole County. Unincorporated Seminole County are one of the county's 7 cities: Altamont Springs, Castleberry, Lake Mary, Longwood, Oviedo, Sanford, or Winter Springs All will be eligible under the business grant program as well as the resident assistance program. An application portal will launch in mid-August as part of the grant application process. All applicants will apply at the portal and upload supporting documents through the portal, so it will not require you to physically come in. We'll also have individuals there. If you should have a question, if you don't understand what documents, you can always reach out and you'll get that information as well to help you and your business assist in getting the proper documentation so we can expedite the program as quick as possible. Seminole Cares and Individual Resident Grants. Seminole County is investing $7 million for individual assistance grants. The program will provide a one-time payment per household for residents affected by COVID-19. Funds for the program will assist residents to bridge financial gaps for rent, mortgage, cost, or any eligible utility expense. The grant amount will be up to $5,000 depending on the housing costs and the application process and what your actual needs are related to the COVID-19. Eligibility criteria: you will have to be a resident of Seminole County or unincorporated Seminole County or one of the county's 7 cities, including Altamont Springs, Castleberry, Lake Mary, Longwood, Oviedo, Sanford, or Winter Springs. You must be a U.S. citizen or permanent legal resident. An applicant must have lost a job or experienced a reduction in work hours due to the COVID-19. The grant expenses: up to 3 months of rent or mortgage assistance. Seminole County will direct pay mortgage companies or the landlords for those payments. Up to 3 months of utility assistance, and Seminole County will direct pay eligible utility expenses to that provider. The application portal for this program will launch again in mid-August. Interested parties should visit prepareseminole.org and county social media platforms to learn more about this program. We're going to continue to put out social media on this. Those of you that have not had the opportunity to visit the website here at the county, Alan and his staff, as well as our public information officers, have been pushing out daily information on numerous social media sites. So if you're Nextdoor, if you're Twitter, if you're Instagram, Facebook, you will be able to find that information and get into the portal that way. But your easiest way is prepareseminole.org or seminolecountyflorida.gov. If you get to those 2 websites, follow the business tab, and you'll get to where you need to be. We're very anxious to roll this out, and we understand the businesses that are hurting. We need to continue to be vigilant, do what's right to make people feel comfortable when they come to do business with you. Likewise, we have launched a website for people to weigh in. We've had a lot of questions about where is it safe to go eat, where is it safe to go to certain places. We'll be spotlighting businesses, as well as businesses will have the ability to post or give us information on specifically what they're doing in the way of making sure that the patrons stay safe. So we encourage the businesses to participate in that as well. Same websites, prepareseminole.org and business tab. If you have any questions, then you can reach out to us at 407-665-0000. And with that, I'm going to turn it over to Mr. Alan Harris, our Emergency Management Director. Thank you, Alan.
Thank you, Chairman. Good afternoon. The Chairman already has thanked our first responders, but let me thank another group of heroes during this pandemic, and that is the frontline healthcare workers. Those workers working in hospitals, at the testing sites each and every day, and 90-plus degree temperatures, testing individuals who would like to get a COVID-19 test. Our healthcare workers in nursing homes and assisted living facilities. When the increased number of patients, the stresses on these individuals is higher than ever during this pandemic so far, as our numbers have increased in Seminole County. We can't thank them enough for their hard work and their care for each and every patient. Speaking of hospitalizations, the number of hospital cases have remained stable anywhere from 175 to 225 patients in the 4 hospitals in Seminole County each day. It is important to note that while the hospitals are busy, the hospitals are ready to accept patients. So individuals that are feeling chest pain or one-sided motor weakness or things that would require acute care, we want you to go to the hospitals. The hospitals are equipped to deal with this type of situation, and they would like you, of course, to go to their centers if you have that need. You should feel very comfortable and safe going to a hospital. The hospitals are cleaner than ever and they're safer than ever. So please, if you do need assistance, don't wait. Go get assistance from the hospitals. Due to the increased numbers of current cases in Seminole County, we have changed our posture in the Emergency Operations Center and shifted from calling COVID patients each and every day to calling them every other day, splitting the list in two. And this is just because it is impossible for us to call the number of patients each and every single day. So we call over 3,324 individuals every other day. So they're on a Monday, Wednesday, Friday rotation or a Tuesday, Thursday, Saturday rotation. The current positive case, as I just mentioned, is 3,324. So that's the current cases that we're dealing with at this time. There are, of course, cases that have completed. So what does completed mean? Completed either means that the individuals have recovered and they're back to their normal life, or in some cases they may have passed away, but they did not pass away due to COVID. They passed away due to some other event. For example, if a person had a heart attack, even though they were COVID positive, their case would be completed. It would not be listed as a deceased patient for COVID-19. Our current fatality related to COVID is 51 individuals as of this morning, and I know we've heard this afternoon that there may be a couple additional to that. We're investigating those at this time. Calls are made every other day, as I mentioned, to check on the person's status, to see if they need assistance with food, medication, and other supports so that they can isolate and quarantine safely in their home so that we can prevent the spread of the virus in our community. As I've mentioned each time, Seminole County has launched a dashboard. Our public information team does an incredible job keeping this up to date so that you have the most current Seminole County information. I don't know of any other county in the state of Florida. I know there are some across the nation, but none in the state of Florida that has their own dashboard. And that dashboard can be easily reached by going to our website, as the chairman mentioned, prepareseminole.org, and clicking the dashboard icon at the top of the page. Drive-up testing continues to be take priority here in the county, and we are continuing to do that at 6 different locations. 6 days a week, Monday through Saturday, at different locations throughout the community. These pop-up sites are moved around the county to make it convenient for individuals to get to a pop-up test site, so it'll be somewhere near your neighborhood. In addition to this, we have drive-up sites that True Health, our nonprofit medical partner, is putting on Monday through Friday at 2 different locations, their facility in Castleberry and their facility in Sanford. And the Florida Department of Health also has a drive-up site at their administration building on Airport Boulevard. Registrations are required for all sites, and you can go to register for those sites at prepareseminole.org. We have registrations available for this week's drive-up sites at the pop-up sites at the various locations in neighborhoods here in Seminole County. Our current positivity rate, as of just a few minutes ago, is 10%. 10% is the target threshold. Any increase in that would put us over that threshold. So where a few weeks ago, about 4 or 5 weeks ago, we were flirting with 1%, low 2%. Unfortunately, now we are at 10%. So that's the number of individuals tested coming back positive at a rate of 10% for the entire event. Personal protective equipment continues to be pushed to assisted living facilities, nursing homes, and hospital systems as supply lines are starting to feel the demand. We have been able to secure supplies for some assisted living facilities and nursing homes, and we're pushing that equipment to them as quickly as possible. Currently, there is approximately 200 individuals in nursing homes and assisted living facilities that are positive, and we're doing everything that we can through the Florida Department of Health, through testing, to make sure that those patients are taken care of, infectious disease control measures are being accomplished, and prevent the spread of the virus to anyone else in those facilities. Our Citizens Information Line is open Monday through Friday from 8 a.m. to 5 p.m. We're very happy now to be able to provide test results to our pop-up sites, the neighborhood-based pop-up sites. Individuals can call and we can give test results. One of our medical professionals inside of the EOC will verify the information and then be able to give the test results from the Emergency Operations Center. And that's Monday through Friday from 8 a.m. to 5 p.m. And as the chairman mentioned, that number 407-665-0000. And with that, I'd like to turn it over to Michael Lawrence with the Seminole County Public School System to give an update. Michael?
Thank you, Alan. We just want to share with our families throughout Seminole County that, as a reminder, that the school year will start on August 17th. The original date was August 10th. We did push that back to August 17th to allow families a little bit more time, as well as our teachers. We also want to share a very important deadline coming up, which is this Friday, July 24th at noon. That's the families' deadline to select one of our 4 student learning options for the 2020-2021 school year. So very important that they make their decisions and get those turned in by that noon deadline. We have 4 learning options available to families. Obviously, we know that it's not a perfect situation, so we want to have as many options available to families so that they can pick the option that's best for them. And those 4 options are face-to-face, which is traditional school, a hybrid model, which is a combination of face-to-face, and our Seminole Connect, our remote learning, our Seminole County Virtual School, and other options as well, which is our Seminole Connect. Our Seminole Connect option is basically remote learning from home. It's very similar to what we had at the end of last school year, but it's been revamped. It's enhanced, and it's more along the lines of having your teacher teach you during a full bell schedule, just like a normal school day. In addition, they'll have the opportunity to return back to campus at the end of 9 weeks. So if things are looking better and a family wants to do so, they can do the first 9 weeks doing Seminole Connect from home and then return back to campus after that first 9 weeks, after the second 9 weeks, after the third 9 weeks, or continue with Seminole Connect the whole duration of the school year. We then have our Seminole County Virtual School option. This has been around for about 10 years. It's its own curriculum. There's more flexibility in the scheduling. There's more flexibility for a student to work at their own pace, and so a little bit easier in terms of a family schedule and when they need to do that work. So that's another option, but we also have an option where they can save their seat at their zone school. So if a student chooses Seminole County Virtual School because of the COVID-19 situation currently underway, we will save their seat at their zone school so they can return at the end of the first semester. Their first opportunity to return face-to-face would be in the second semester in January, or they can continue with Seminole County Virtual School for the full duration of the school year and return to their zone school the following school year if things improve. We want to share with families that we have an FAQ on our website. Our website, again, is www.scps.us. The very top of the page in the photo slide, the very first item, is information about all things SCPS reopening plans and our student learning options. When you click on that, there's information there on how to select a student learning option, as well as an FAQ that will help address many of the families' questions that we've been receiving over the coming days. Again, we know that families have a short time window to make a selection, and you have a lot of questions, and there's a lot to factor in and making a decision that's best for you. So that FAQ will help with that. We also just completed several Facebook Live sessions. We did elementary yesterday. We did middle school and high school today. Tomorrow morning at 10 a.m. we will do a Spanish-speaking session as well. And all of those are archived and available on our SCPS Facebook page and on our YouTube page. And we'll be submitting those out to families upon their conclusion. Many of your families should already have received those. Our high school one will go out this afternoon. As of this morning, more than 26,000 families of our 67,000 plus students have actually made their selection so far. Of those, close to 7,000 have selected face-to-face, and approximately the other remaining 19,000, one of our at-home learning options. We also want to remind families that kindergarten registration is still underway. We know that several families are waiting for that domino to fall of our reopening plans and what our student learning options for the fall are going to be before making their decision and enrolling their children. But if you have a kindergartner out there and you haven't already enrolled them, it's very important to do so immediately. That helps us with our teaching numbers, with our student numbers, and preparing for the school year for your students. So if you have a kindergartner, please register them. We have kindergarten registration online. It's on our website, again, www.seps.us, but the time to enroll is now. In addition, yesterday, we determined that we would move back the start of fall practices for all sports to August 31st. So obviously we had some sports that were underway for a little bit, and we had to stop those and postpone them. We're postponing the new date to resume practices till August 31st. And what that'll allow us to do is, since we're returning back to school on August 17th, it'll give us about approximately 2 weeks to really see how things are going, to see if we have to postpone those further or if we can continue as currently planned. In addition, we want to share with families, a lot of questions have been coming in regarding face shields and desk shields at our schools. The district has ordered 25,000 desk shields, and we'll use those in areas of need throughout the district. And we also know that there's several community groups that are working to donate face shields as well as desk shields, and we'll gladly accept those, and we appreciate the work being done in that area. With that being said, that concludes our update, and I'd like to turn it over to Donna Walsh with the Florida Health Department. Thank you.
Thank you so much, Michael. First, I would like to thank all of the parents and teachers who have sent messages sharing your concerns. I've received hundreds of messages from you all, and I want to thank you so much for sharing your concerns. I also want to reassure you that Seminole County Public Schools has done an exceptional job preparing a plan with multiple options, as Mr. Lawrence described, for those who are very concerned with face-to-face instruction. So I would encourage you to review those plans, and if any questions, please contact Seminole County Public Schools. I know that there has been some confusion as to what the role of the local public health official is in reopening schools. Certainly, Seminole County Public Schools, as with other school districts, have consulted with their subject matter experts, including public health, to provide guidance and also to get a better understanding of what the public health risk is locally. With that, I would say we have been actively involved in the planning task force with Seminole County Public Schools, and in fact had a call today in planning, in the event that there is an exposure, what are the guidelines to address that exposure. The Department of Education, their emergency order, does not allow for health departments to issue any orders for opening or closing schools, however. But we will be, continue to be actively involved. And so as you prepare your kindergartners to start school, and certainly with the 7th grade requirement as well, please know that the health department has remained open through this event, providing essential services, and we will continue to provide those services, including physicals, childhood physicals, and immunizations. So if you would like to make an appointment, because of social distancing, we are this year scheduling those services by appointment instead of having everybody come in and congregate into the auditorium. Of course, we want to adhere to social distancing as well. So please call us, our information line and our appointment line at 407-665-3000 if you would like to make an appointment. Our epidemiology department, as I mentioned, is working very closely with the county on epidemiology case investigations, contact tracing, as well as any evidence of outbreaks. But we also are working closely, as mentioned, with the schools, because we want to make sure that the schools are well equipped to address any staff member, teacher, or student who may have been exposed to COVID or may actually be exhibiting symptoms of COVID. And so those planning processes will continue to make sure that everybody feels assured. As well as it's very important for those who are attending schools, just like we've been messaging honestly throughout this event, to follow those guidance principles that will protect us from spreading the germ wherever you are. And so the facial coverings, of course, social distancing, and hand washings. I will say that Seminole County Public Schools has done an exceptional job making sure that those things are in place in the school setting so that they will minimize the spread. As far as, I know Mr. Harris, our emergency manager, Alan Harris, had mentioned some of the data. And we are seeing evidence right now that, especially this week, that we're seeing a little bit of stabilization in the numbers. The numbers are still much higher than they were in May, of course, but we were averaging 0 to 5 cases a day back in May, and sometimes just as much as 15 to 20 cases for the week. However, in the last couple days, we've seen cases 81, 111, and 116 daily. In the last month, we were averaging anywhere from 80 cases all the way up to the low 200s. So we are starting to see a bit of a stabilization. We're cautiously optimistic that with everybody doing their part, that we perhaps are seeing evidence that the numbers of cases are declining. So we are going to continue to do what we have been doing in order to see those numbers come down even more. I know we've mentioned that the demographics or the age group where the number of cases are occurring had shifted, and we're still seeing evidence of that. Most of our cases are occurring in the 20 and 30-year-old age group right now. We're also seeing, if you look at it, 43% of our cases reported overall have been in the 20 and 30-year-old age group. 57% have been in the 20s, 30s, and 40s, and then 70% of our cases have been in the 20s, 30s, 40s, and 50-year-old age group combined. So it still stands that those most vulnerable are those who have underlying health conditions and are elderly, no doubt. Most of our deaths have occurred in the elderly population. Certainly people who are younger can get this disease and they can die. It doesn't mean that you're exempt, but you are most vulnerable if you're in those situations that you have an underlying health condition or you're elderly. So we want to do our part to protect our friends, families, neighbors. This is what you do. You prevent the spread of the disease through the by sharing respiratory droplet. We are, if you think back in May, where I had this lovely chart over here, that we were looking at flattening the curve. As was shown in the last several press conferences, we showed evidence of exponential growth where that curve just climbed pretty rapidly. We're looking at a little bit of stabilization, but at a higher level. We're up to 5,633 cases reported overall here in Seminole County as of this morning's report. As Alan mentioned, our overall positivity rate is 10%. We were at an overall rate of 2.2% in May, but our daily positivity rate is something that we look at as well. So since July 16th, our daily positivity rate has been under 10%, and today it was 8.1%. So again, there's signs of improvement, and we're holding on to that and hopeful that we can get that curve to flatten again. July 8th was the last time that we saw evidence of a rate that was pretty high, 13.1%, a daily positivity rate. It is very helpful to continue offering testing because with the information that we're sharing, the data that we're sharing, it's only for those folks who've actually gone to get tested. There's many people who are asymptomatic, we've talked about this before, or mildly symptomatic, and they may not feel the need to go to the doctor and get tested. So this is just what we know. Our population is about 471,826 here in Seminole County. So if you look at it with what the data that we have, only about 11.65 per 1,000 population are infected today. But again, that's just what we know, and that's not everybody in the community who may be positive. So I would encourage you, if you have concerns about your safety or any concerns about returning to Seminole County Public Schools, please revisit the 4 options. As I mentioned, there are certainly options for parents to keep their children at home if they feel unsafe. And if you are a teacher or faculty or staff member, please consult with Seminole County Public Schools for accommodations that can be made. With that, we'll take any questions. Or Chairman Zimbauer, would you like to come back up?
Go ahead.
I have a question.
Yes.
I got a couple questions.
Sure.
Is there concern about the long-term care facilities right now? Alan mentioned 200 people in there. If I have a loved one that's in one of those facilities, should I be concerned about them?
The long-term care facilities usually care for those who are considered our vulnerable population. So there's a concern just because they're part of our vulnerable population. We are monitoring long-term care facilities daily, multiple times a day, oftentimes, and weekly calls to address any issues that they may have. And if we get a report of a positive staff member or resident located in that facility, they get multiple visits, not only from the health department, our healthcare acquired infection epidemiologist, but we call in teams from Tallahassee, incident management teams, training teams, to make sure that facility has their infection control measures in place. So to answer your question, is that population vulnerable? Yes. Are we monitoring?
Are you concerned about it? 'Cause recently, we've seen a lot of people who are dying in that area, and I don't think we've heard that much of a number before in this
Right.
county. So
Right.
is that a real concern right now for here in Seminole County?
It's a concern throughout the state and nation, honestly, globally. Yes, with an increase in the number of deaths that we're seeing, that often is occurring in vulnerable populations, the elderly. There's certainly a larger percentage of those who are elderly or who are dying. And do many of those reside in these long-term care facilities? Unfortunately, yes.
And then I have a question about schools. I know you are working with the schools.
Yes.
And the question keeps coming up during the question and answer sessions online about what happens if somebody gets COVID or is positive. Is there a plan to actually shut a school down to clean or contact trace or do whatever? Is that part of a plan? We haven't heard. I guess it's still sort of they're working on it.
Sure. Seminole County Public Schools has it, and I won't speak for Michael here, but I know that they've included in their planning terminal cleaning. We have that process in place now with any facility, whether it's a business or elsewhere, where they may have had a case where we can provide that cleaning service. So I know that it's part of their plan. As far as contact tracing, that's our usual process as well. If we find that someone is positive, we will do contact tracing. And if appropriate distancing is in place in facial coverings, that reduces the risk significantly. So, we would not necessarily have to close a school unless we see that those things were not in place and there's a likelihood for it to spread in that classroom. Of course, it's going to be case-by-case basis, whether you're dealing with an elementary, middle, or high school, because it depends on the social interaction and the possibility of someone spreading it. The standard is 15 minutes or longer, less than 6 feet apart, without the proper protection.
And when we're talking about the population that we're seeing getting this virus right now, the bars have been shut down for a while now. I know there's a delay in the results getting back for a majority of these things, but when you're doing your contact tracing, where are they believing they got this from? Are there gyms, restaurants? I mean, where do they believe they're contracting this from?
Yeah, there's evidence of spread throughout our community, so it's all of the above. We're not seeing one particular area where we're seeing all of the spread. When we do our investigations, it could be, we went over to a family's house and my cousin got symptoms 2 days later. We go 48 hours before onset of symptoms, so that person's exposed. Oftentimes it is family gatherings, as people are trying to reconnect. They oftentimes, especially family and friends, aren't wearing the protection. So, we're seeing it honestly across the board.
I have a question for Mike. In terms of the numbers that you have so far, you said 7,000 face-to-face, 17,000 are looking at the other options. It appears that more parents are looking at teaching virtually at this point because they are concerned.
So the question was, are we seeing a higher number of folks who are interested in at-home learning as opposed to face-to-face? And the answer to that is obviously yes, which is kind of what we want to see. We know that this is a situation that for a lot of families, it's very difficult to choose what's best for them. And so that's why we have the 4 options. As of now, the majority of folks that have already submitted their request is for one of those at-home options, and that's kind of what we expected. The good news is that for those who are deciding or have no choice but to send their kids to one of our face-to-face campuses in the fall, is that it also means that the campus numbers will be lower, which is good for when it comes to social distancing and doing all the things that we need to do to keep our teachers and students safe. For us, we hope that families who can make those choices and keep their students at home, if that's a decision they choose to make, that they do so. And we've given them those 4 options, and whatever works best for that individual family is what we want to support, and that we want to support them with their educational plan for the fall.
How important is it that you hear from these people by noon Friday?
So the question was, how important is it that we hear from our families by noon on Friday to make their selection? And I will tell you, Dave, that it's very important. The reason for that, it's a domino effect. And so we need families to basically tell us what their choice is by that deadline. What that allows us to do is see where we need to send our teachers to support those areas. It's a numbers game. We obviously will have teachers that we want to accommodate as well that might have some issues, and maybe they want to teach remotely or teach with an empty classroom, a Seminole Connect class, or work and help and assist our Seminole County Virtual School if they need more teachers in that area to support the student needs. And so it's very important that parents make those decisions by Friday. That'll allow us to do our work to move the teacher assets around, as well as all the scheduling that needs to occur to make those happen as we approach that August 17th start date.
Well, I know we've got the teachers union that's filed suit against the governor and the State Board of Education, saying that they don't believe that it's appropriate for them to go into schools. Do you worry that you're going to have teachers that don't show up this fall, or that you have mass retirements and you're going to end up with not enough educators?
So the question is, are we concerned that we may not have enough educators to start the fall due to retirements or those who maybe leave the profession, for example? That is a concern for all of our districts. That's always a possibility. Right now, we're not seeing that, but things can change, and they can change rapidly. At present time, we have enough teachers, and what our biggest concern is proportioning and trying to accommodate as many of those as possible in the areas that they choose to teach, if they do have some fear of going back in the fall and not doing face-to-face. So that's our first concern. But obviously, we have a pool of substitute teachers, and again, that could be a concern as well as we go into the fall. It really just depends. So everything has a little bit of a domino effect. Once we move past one hurdle, other ones will come up, and we'll address those accordingly. We do have contingency plans, and we will adapt as needed, but I think that's a concern for all of our school districts, because obviously teachers have to choose to return. We obviously have a lot that will return face-to-face. We have some that choose to volunteer for our Seminole County Virtual School and support that, and we know that we're going to have a lot who will be willing to support our Seminole Connect model as well. But how many, that really will be to be determined as we move closer along to that August 17th start date.
I've heard there's some concern among teachers that teach elective courses. When you're talking about like math and English and stuff, which can be done online, a lot of the electives are hands-on type activities, so they're concerned that they're going to be bombarded with students who want to do that hands-on class. Is that a concern that you guys are looking at, and how to limit the number of kids in those classes or per class?
So the question was how we're handling basically the elective type classes for the next school year. And in our Seminole County Virtual School has some of those available, so those selecting that model will have some of that, that hands-on work. And then Seminole Connect will also have some of that. It'll be a little bit different because nothing's going to be the same as face-to-face education. So if you're doing one of the at-home learning options, the fact is it just won't be the same. You will be in front of a computer. You will have assignments. The pace will be a little bit different depending on which selection you choose. But we will have options. So aside from your core classes, we will have those other elective type courses available through Seminole County Virtual. And if there's not those available through that, definitely through the Seminole Connect option, we will have those same classes available. Will they be the same? They won't be the same. And if you choose the hybrid model, well, some of our families are choosing that so that they can have the face-to-face option for, say, band, for example, or chorus, or for some of those electives to get that face-to-face element as part of their course curriculum, and then doing the rest of at-home learning. So it's going to be a little bit different for sure, but we will have those courses available for our families depending on which selection they choose. Will just depend on what's available.
You know, yesterday in the Q&A with the social media with the elementary parents, you brought something up that I think a lot of people are wondering about. So you choose face-to-face, you send your kids to school. Right now we're hearing that the numbers are starting to flatten out, and that's encouraging and all that. If we have something unforeseen happen and we have a spike, SCPS, you're prepared to send the kids home again if it proves that you don't believe it's safe, right?
Correct. So the question was, If we see numbers continue to spike and we absolutely have to, would we return to the at-home model like we did at the end of last school year? The answer is yes, we do have a contingency plan for that. We have contingency plans for almost every step of the way because we have to be prepared, and we don't have a crystal ball to really know what's going to happen by the time we get to August 17th. We hope things go on the decline. We hope things get better and improve. But we do have contingencies in place. That's part of our job, is to be prepared. And so if that were to happen and things continue to spike and the states and our health department and the CDC says we need to reverse course, we most certainly will do so, just like we did it on a dime at the end of last school year. But we are prepared to do that.
You don't have the latitude to do that without State Board of Education, right?
I mean, we would be working in line with the state and with health department and the CDC to make those determinations, yes.
Michael, just real quick, for people, the high school webinar got cut short. There was a technical glitch. Explain exactly what parents can do to see the rest of it.
Sure. So the question was, we had a high school Facebook Live session this afternoon at 1 o'clock. Midway through, there was a technical difficulty with our internet at our building, so it may have froze or stopped midway through. The session was still being recorded live and streamed, so that will be on our YouTube channel. It probably is already on there now, as well as our Facebook. And we will be email blasting that out to all our high school families this evening, as well as staff.
And real quick housekeeping, bus drivers? I saw a sign the other day, in front of one of the elementary schools said, hey, we need bus drivers. I kind of recall that's every year. Do you anticipate having a difficulty? Because a lot of the people who are bus drivers tend to be middle age to a little bit older and often retired. Are you going to think they're going to have a difficulty filling all those seats?
So that's a great question. The question was, how do we look on bus drivers for the fall? That's usually always an area of need for us. I will tell you that still is an area of need always. So we were looking to hire more bus drivers. But again, that could change. Really, once we know what families' decisions are made after that July 24th, this Friday's noon deadline, that'll also allow us to make our bus routes and know how many drivers we really truly need for the start of the school year for those that are electing the face-to-face model. The trend right now is that those selecting face-to-face is lower than the at-home model, which means more than likely we may need less drivers. And so we're also looking at a plan to see, just like we did over the summer, to try to keep as many folks employed and what we might do with those drivers. So we do have to reduce the amount of drivers if we have less of a need, to still keep those folks employed and try to see where we can move those assets in other areas, no different than we did during the summertime as well.
And Michael, one of the things I heard on the webinar today was they were talking about if a student or staff tests positive, they will have to be gone for 10 days. What happened to the 14 days that for quarantine with this? Why is it 10 for the kids?
So the question was during our Facebook Live session on middle schools today at 11, there was a question about if a student or staff member has COVID-19, or really I believe the 10-day had to do if they were in contact with someone that they would have to self-isolate for about 10 days or so. I don't know. I would defer to Donna in terms of the exact dates based off what was shared. Obviously, we're going to be in line with the Florida Health Department and what their recommendation is, and I believe that is outlined in our school reopening plan. So I'll defer to Donna of what that has to be, but we're going to be in line with them. They're going to dictate that, as well as the health professionals, of what that timeline has to be and when students or staff can safely return.
I'll just clarify real quick. So there is a lot of confusion around the 10 and 14 days. The 10 days is for someone who's diagnosed with COVID. They have a positive test. And that's the period of time that the CDC has set forth that they would be considered infectious. So 10 days after their onset of symptoms, they can return. The 14 days, it has to do with those who are exposed to someone who's positive, because the incubation period is 2 to 14 days. So even though somebody may be tested within that 14-day period while they're in quarantine, they still need to be in quarantine for that full 14 days because they could develop symptoms any time within that incubation period. So I don't know if that helps, but that's the standard currently.
Donna,
Yes.
you mentioned that cases are starting to kind of stabilize
Yes.
a little. Is it at all possible to draw, because it's been about 3 weeks since the mask mandate went into effect, is it at all possible to draw a correlation between the stabilization of numbers and a lot more people wearing a mask?
This is certainly a valid question, and I think the question was, is there a way that we can correlate the stabilization of cases at this moment with the mask order? And honestly, I think it's too early to make that determination because we've only seen evidence of stabilization this week, within the last week. So we will be watching very closely. I mean, certainly the social distancing, reducing the sharing of respiratory droplets, that's been known from the beginning to reduce the spread of this disease. So, you would think that masks would be helping. But honestly, we couldn't show evidence of that just yet because I think it's too early on.
Are there any other questions for any of the folks that were here today for the press conference? Well, seeing none, we'll get ready to turn things over to Freddie Gonzalez, which is going to do our Hispanic translation and presentation today. And happy birthday to Freddie. Today is a wonderful day here in Seminole County. It speaks volumes when our employees actually spend their birthday actually doing the people's work, so that's fantastic. A little bit of good news. On the business front, for those that watch numbers, Seminole County remains the lowest unemployed in the region. We have the best employment numbers thus far in the region. They're still not good, but they are the best in the Central Florida region. And this is why it continues to be important to do the social distancing, do all the things the CDC recommends, including when you can't keep your distance, to obviously wear your mask in those tight quarters, whether you're inside of a business. And what we're seeing, of course, is many businesses nationally as well as locally are now requiring masks to even enter their stores. So with that said, I want to thank everybody for being here today. Be well, and God bless you.
Buenas tardes, este va a ser el resumen en español en la conferencia de prensa el 22 de julio del 2020. Empezó hablando el presidente de la Junta de Comisionados del Condado, Jay Zimbauer. Mencionó que la Junta de Comisionados del Condado aprobó un paquete de alivio que va a ser un total de $82 millones para ayudar al condado de todo lo que fueron afectados por el COVID-19. Eso fue aprobado la semana pasada, el 14 de julio, el martes. Este programa se va a hacer llamado Seminole Cares. Eso va a ser 7 millones para los fondos a los residentes que fueron afectados y 10 millones también para los negocios pequeños que fueron afectados también. Vamos a seguir con el fondo de negocios pequeños, que va a ser una segunda ronda, que va a ser en el medio de agosto, que vamos a estar aceptando aplicaciones. Fue un cambio que ahora va a ser, los negocios pueden recibir de $5,000 a $15,000 en este fondo. $5,000 puede ser recibido a los negocios que es basado en la casa o negocios móviles también. También pueden recibir $10,000 a negocios que tienen de 2 a 25 empleados o $15,000 de negocios que tienen de 26 a 50 empleados. Vamos a estar dando más información más tarde esta semana de lo que lo que se requiere para ser aceptado para este programa. Y también vamos a tener más información en nuestras redes sociales o también en nuestra página en prepareseminole.org. Ahí vamos a tener más información, lo que se requiere y lo que es necesario para ser aceptado en ese programa. A la misma vez estamos dejando de saber a los negocios que pueden estar en alerta con el correo electrónico que estamos dando de este programa. Pueden ir a la página seminecountyfl.gov y elegir la opción Business, que es negocio, y elegir Sign Up, que da la información y notificación de lo que es necesario para saber de este programa. A la misma vez, acordarse que este programa es solo para los negocios que están en el condado de Seminole. Esto no es para los otros negocios que están afuera del condado. Un acuerdo que va a ser empezando en el medio de agosto y vamos a estar ayudando. Uno de los programas va a ser, como dije antes, 7 millones dedicado a un programa de los residentes que fueron afectados por el COVID-19. Va a ser ayudando con las rentas, hipotecas o cualquier gasto mensual que no podían usar o lucharon de usar durante la pandemia. Pueden recibir hasta $5,000 dependiendo las situaciones o el costo de vivienda y cuántas personas necesitan. Acuérdense que esta persona tiene que estar viviendo en el condado de Seminole, tiene que ser un ciudadano americano o residente, y también tiene que aplicar si perdieron un trabajo o perdieron muchas horas en su trabajo que tienen ahora. Pueden ayudar hasta 3 meses de renta o de hipoteca o cualquier gasto mensual que tienen. Para más información, otra vez pueden visitar a la página prepareseminole.org. Después vino el oficial de comunicaciones, después vino el oficial de comunicaciones públicas, Michael Lawrence. Recordarse que el 17 de agosto empiezan las escuelas. El 24 de julio, este viernes, es donde se acaba el tiempo de elegir las 4 opciones que los padres pueden elegir por sus estudiantes, que es de cara a cara, o si no por el internet, o si no se llama hybrid, que eso también es una opción de mezclar entre cara a cara y también el internet. Y a la 4 opción es Seminole Connect, que tenés el día entero como si tuvieras en persona, pero va a ser todo por la computadora. Tiene más información y más preguntas, pueden ir a la página de eso, que es www.scps.us. Ahí tiene toda la información. También están teniendo un Facebook Live que es vivo del Facebook en español mañana a las 10 de la mañana para dar más información o cualquier pregunta pueden dejarlo saber ahí. Para dejarles saber, de los 67,000 familias, ya 26,000 de los estudiantes fueron elegidos las opciones. Acuérdense que también para el jardín de infancia se pueden registrar en cualquier momento. Y los deportes y actividades después de la escuela no se va a empezar hasta finales de agosto, en el 31 de agosto. También las escuelas están compartiendo 25,000 mascarillas o cubiertos de máscaras en el momento. También habló nuestro gerente de emergencias del condado, Alan Harris, dando mucho agradecimiento a los empleados de hospitales que están dando mucho sacrificio en este momento. En este momento los hospitales están teniendo 175 a 225 pacientes por día, pero eso no significa que los hospitales no están disponibles. Él quería dejarles saber que los hospitales están disponibles, están seguros y no hay que tener miedo para ir si hay alguna necesidad. Acá vamos a estar llamando a todos los que están positivos cada 2 días, que eso es más o menos 3,324 personas que están recibiendo nuestras llamadas, asegurar que no necesitan cualquier necesidad de comida, medicación o cualquier otra cosa. Hay en este momento, afortunadamente, 51 muertos por el COVID-19. Y en nuestra página en prepareseminole.org tenemos más información y a la misma vez tenemos más números de lo que tenemos de prueba, de lo que están con el virus y lo que están en los hospitales. Tenemos un sitio de prueba todos los días por 6 días a la semana, de lunes a sábado. En cada lugar va a ser un diferente lugar todos los días por el condado. Esto lo hicimos para que cada residente en el condado pueda tener un sitio que pueden ir para tomarse la prueba si es necesario. Están dando el equipo personal de protección a las casas de salud, los hospitales y casas de rehabilitación para ayudar a controlar más el virus en esos lugares. En este momento por el condado hay 200 positivos que están en esos lugares y estamos en el condado haciendo todo lo que podemos para tratar de limitar esa situación. A la misma vez, si tienen alguna pregunta, estamos disponibles de lunes a viernes de 8 de la mañana a 5 de la tarde a nuestro número de residente, que es 407-665-0000. Finalmente, habló la directora del Departamento de Salud, Donna Walsh, que mencionó que las escuelas públicas del condado ha hecho un gran trabajo con planificación de reapertura de las escuelas. Ha dado, como dije antes, 4 opciones para los padres para elegir para sus estudiantes. Los casos del COVID-19, aunque hay más casos de abril y mayo, está más estable en este momento. Antes había 200 por día estamos recibiendo, pero ha bajado en las últimas semanas 100 casos por día. Estos servicios del Departamento de Salud han dado las puertas abiertas, siempre estaban abiertos todo este tiempo y están ayudando y compartiendo con el Departamento de Escuelas Públicas, ayudando en este proceso. Las escuelas van a estar notificando al Departamento de Salud cada vez que ven que hay un caso de un estudiante o maestro o cualquier persona en las escuelas que puede estar infectado con el virus. Tiene una estrategia que están formando para hacer o limitar este virus contagiarse más de los estudiantes o los empleados o maestros. Las escuelas públicas y el Departamento de Salud piden que los padres, los estudiantes, maestros y todo personal de las escuelas que puedan seguir las recomendaciones para limitar este virus en contagiándose los otros. También el Departamento de Salud siempre está abierto para si hay un padre que quiere vacunarse, hacer exámenes físicos o cualquier de esas cosas antes de empezar el año de la escuela escolar. Finalmente, ella también mencionó que en este momento hay 5.630 casos y antes en el mes de mayo había una tasa de positividad 2.2%, pero en este momento está un 9.9%. Ella mencionó que un estimado de 470,000 habitantes hay en este condado, eso hace una tasa de casos por cada 1,000 habitantes a 11.65 personas cada 1,000 habitantes. Si quieren una cita de prueba, tiene cualquier pregunta o necesita más información, puede ir, como dije antes, a nuestra página de internet en prepareseminole.org. Se escribe prepareseminole.org o también puede dar una llamada al 407-665-0000. Gracias.